Could free NHS prescriptions end in 2026? What over-60s must know. Imagine walking into your pharmacy tomorrow and being told your prescriptions are no longer free. For millions of over-60s in England, that could become a reality as early as 2026. But is this just a rumor or a warning of changes that could hit your wallet and your health? Today, we're breaking down everything you need to know before it's too late. First, a quick refresher. Since 1968, the UK has offered free NHS prescriptions to certain groups: children, over 60s, pregnant women, and those with certain medical conditions. For people over 60, this has been a huge financial relief. Some may not realise just how much they save each year. Prescription charges in England currently cost £9.65 per item. If you take multiple medications, that quickly adds up to hundreds of pounds a year. Free prescriptions aren't just a convenience, they're a real support for keeping health costs manageable. So why is there chatter about this potentially ending? There are a few factors at play. The NHS is under enormous financial pressure, especially post-pandemic. Hospitals, staff salaries, new treatments, and technology upgrades all demand funding. Politicians and health policy analysts have started questioning whether exemptions, like free prescriptions for over 60s, are sustainable long-term. The government has hinted that tough decisions may be necessary to keep the NHS financially stable, and naturally, prescription costs are a big part of that discussion. It's important to stress that nothing is official yet. There has been no formal announcement that free prescriptions for over 60s will definitely end. But speculation alone is enough to make anyone nervous, particularly those who rely on multiple medications every month. Over 60s often manage chronic conditions such as diabetes, high blood pressure, or heart disease, meaning their regular prescriptions are essential for day-to-day life. Any changes could have a huge impact on both health and finances. If changes do come, it's likely that the government would phase them in rather than cut them abruptly. One scenario experts discuss is gradually increasing the number of people required to pay, or introducing a partial subsidy instead of full exemption. This might mean that someone who previously paid nothing could suddenly have to pay £5 or £6 per prescription item. While that may not seem catastrophic at first glance, for those on multiple medications, it could add up quickly. Another point worth noting is that this debate is particularly focused on England. In Scotland, Wales, and Northern Ireland, prescriptions are already free for everyone, regardless of age. So the concern mainly affects English residents. This also means any change would likely become a highly debated political issue, especially around election periods, because health policies often influence voter sentiment. So, what should over 60s be thinking about right now? First, don't panic. There is no confirmed change at this stage. But it's a good idea to be proactive. One practical step is to check whether you are already eligible for other types of help with prescriptions, like income-related exemptions or medical exemption certificates. Some people over 60 might qualify for both age-based and health-based exemptions, which could provide additional security. Another useful move is to plan financially. If you take multiple medications, it might be worth estimating how much your annual prescription costs could be if free prescriptions were removed. Even a rough estimate helps in budgeting for potential changes. Some people even consider prepaying for prescriptions through the NHS prepayment certificate scheme, which allows you to pay a set fee for unlimited prescriptions over a period of time. That could become a useful option if charges increase. It's also worth keeping an eye on political developments. Healthcare is a major policy topic, and any proposals to change prescription exemptions would likely be discussed publicly. News updates, government announcements, and NHS communications are your best sources for accurate information. Social media can spread speculation quickly, but it's not always reliable. Finally, it's important to remember the bigger picture. The NHS provides an incredible range of services free at the point of use, and prescription exemptions are part of a wider system designed to support those who need it most. While financial pressures are real, health experts often warn that cutting preventive care, including regular medications, could actually lead to higher costs in the long run if untreated conditions worsen. In short, Over-60s should stay informed, check eligibility for all available support, and plan ahead just in case. The conversation about free prescriptions is ongoing, and 2026 could bring changes, but preparation and knowledge are your best defense. The key takeaway is simple: don't wait for a change to surprise you. Keep track of your medications, your costs, and the official news, so that whatever happens, you're ready.